This is obviously something that has evolved and something that we've paid a lot of attention to, and I've had discussions with all of the union leaders about where we're going and why. And firstly, I'll refer you to a document I mentioned yesterday, which is the ethical framework for allocation of PPE, and it goes through the thinking and the rationale and the why we've done what we've done. So it is in times of need that you need to make these decisions, and you need to do it in a way that's safe for everybody. And it is, and I've mentioned this before, it is a change in the way we've thought about how we wear personal protective equipment. And it's for two reasons. One is to protect, of course, the healthcare workers, but it's also how do we best protect our patients, because we know in long-term care, we know in the hospital setting that it can be unrecognized illness in a healthcare worker as well that transmits to patients in those settings. So we have done a reorganization of how people are cared for in the acute care sector and in long-term care homes, but particularly in acute care. So things like cohorting. So these are all well-recognized infection prevention and control practices that allow us to spare the amount of personal protective equipment people need. So when you have patients that are scattered throughout a hospital, for example, or a facility, you have to change your personal protective equipment every time you go in and out of the room between a patient, because you don't want to deal with somebody with COVID or with something else like a methicillin-resistant Staph aureus, for example, and then you go to the next person and you have to put it back on again. So, and we know that every time we put on or take off our personal protective equipment, we're likely to contaminate ourselves. So the rationale is for safety of the healthcare workers, for safety of the patients, and also to spare us the amount of PPE. And I mentioned a couple of weeks ago that the burn rate, the number of respirators, for example, that were being used per patient with COVID-19 was astronomical, and we went through a huge amount of those respirators. And we've talked about this. There is a shortage globally around respirators, around medical masks, and that's important that we need to preserve those for our healthcare workers. So it is absolutely safe to be wearing one face mask, so a surgical mask, and eye protection and visors are the most common, face shields are the most common ones we're using, gowns and gloves for a whole cohort of patients. So if I'm dealing on the COVID-19 ward, then I can wear it for the entirety of my shift unless it gets splashed or dirty or damaged. And that is a well-recognized safe way of using personal protective equipment. It reduces the amount of time I might contaminate myself by taking things off and on. So it is something that is within the guidance that we have internationally and nationally, and certainly it's what they're doing in the United States, in the WHO guidance as well. But I would refer you to the document that we've put out that lays out exactly why and when we would do different strategies, and and the ethical principles behind it. That we are adhering to in rolling out these strategies at this point. In terms of the amount of PPE, it's a moving target, but I can assure you, and I know the Minister can as well, that we are doing everything. There are many innovative things that are happening. We're looking at ways, and there's studies that have come out of both the U.S. and the WHO about repurposing and reprocessing, we call it, but cleaning, essentially sterilizing respirators and using them more than once. We're not doing that yet, but we are investigating to make sure that that could be available if we needed to, if we got to the point where we weren't able to get any respirators, and we know that that would put people at risk. So there are many different things that we're looking at across the province. Businesses are stepping up to help. I mean, there's 3D printing businesses that are looking at, that are working with us around visors, not visors, face shields that can be used in the healthcare setting. So there's many innovative things, and I think we have to be that way right now. If we look around the world, there is everybody is trying to get the same equipment, and we are very thankful that recently, just today, I guess, I don't know if you want to talk to what's happening. We got a plane load of masks in earlier this week, which is great, medical masks, and we have some respirators that are on their way now. Plane actually landed in Canada, but I can't stress enough how challenging it has been to source the equipment that we need. And it's on a day-by-day basis. We have a whole team at the ministry as part of our emergency response that has been looking at the logistics of this from January, because we knew back then that this might be an issue. And they are across all of the health authorities on a day-by-day basis, trying to understand exactly how much is where. And we know right now we're okay. There was a period of time where we were using a lot, that we had only a few days supply left, and we let you know that. So it's changing day by day right now. Our colleagues in Quebec are at a point where they're very, very concerned. So hopefully this flight that came in with equipment today will help support them as well.